19th century surgery. By the time surgery had reached the 19th century, the barber surgeon was increasingly only there for the very poor. By now, surgeons were usually gentlemen who had studied anatomy and medicine. This was not always the case, as social positions sometimes replaced a need for qualifications. After the case of Bransby Cooper, the General Medical Council was set up to ensure no untrained surgeons would operate again. Surgery had been a risky business despite regulation. Death was common and pain inevitable. However, in the 19th century, progress was made with the latter. Firstly, anaesthetic. Pain and surgery came hand in hand. In fact, many surgeons considered it essential. A, to make it clear the patient was still alive. B, so the patient appreciated the work the surgeon had done. However, it was far easier with a quiet and still patient. Humphrey Davy was an early user of nitrous oxide. Robert Liston later used ether, but anaesthetic's big break came when Queen Victoria used chloroform during childbirth in 1853. This had been championed by James Simpson, and the concept of general anaesthetics was established. Towards the end of the century, local anaesthetics were being developed, especially after adventurers brought back cocaine from South America for the first time. Secondly, antiseptic. Towards the end of the century, the acceptance of germ theory led to pioneers to try to make surgery safer. The high levels of infection were the biggest threat, but by knowing what caused it, doctors could reduce it. Joseph Lister began using carbolic acid throughout the surgery and beyond, and vastly reduced the number of deaths. His surgery theatre spray became the standard for antiseptic surgery as the century drew to a close. This developed into aseptic surgery with things like steam sterilisation of equipment, sterile theatres, and surgical clothing. As a result, by the end of the century, survival rates were better.